Moving respiratory consideration procedures for preterm babies could prompt further developed well-being results. Inspected by Emily Heaus that neonatologists are moving the kind of respiratory help they use for preterm babies, a move that could prompt further developed well-being results. Utilizing two huge public datasets that included more than 1 million preterm babies, scientists in another Vanderbilt Drove study found that from 2008 to 2018 there was a more prominent than 10% reduction in the utilization of mechanical ventilation for this patient populace. Simultaneously, there was a comparative expansion in the utilization of non-intrusive respiratory help, for example, ceaseless positive aviation route pressure, CPAP, for these newborn children. The investigation, Changes being used of respiratory support for preterm infants in the U.S., distributed July 6 in JAMA Pediatrics. It's a quite enormous example of overcoming adversity for the field of neonatology. We've had the option to keep a ton of infants off mechanical ventilation and possibly spare them of lung injury and wounds to other organ frameworks also, said Dupree Hatch, MD, MPH, Senior Examination Creator and Collaborator Educator of Pediatrics in the Division of Neonatology at Monroe Carell Jr. Youngsters Hospital at Vanderbilt. For preterm babies, mechanical ventilation can have antagonistic aspiratory and neurodevelopmental results. To decrease these dangers, neonatologists in the course of recent many years have been investigating and exploring non-intrusive respiratory help alternatives like CPAP treatment for these newborn children. A significant part of the change in mechanical ventilation found in the investigation harmonized with a huge report delivered in 2010 that showed mechanical ventilation was not better than non-obtrusive ventilation, and truth be told may imply more dangers. In numerous examinations, mechanical ventilation has been related with unfriendly results. There are a few examinations that show for consistently you stay on a ventilator as a preterm child, your chances of having antagonistic neurodevelopmental results go up, Hatch said. Since huge investigations were distributed in 2008, 2010 and 2011 appearance the viability of non-intrusive respiratory help, we believed that respiratory help designs in preterm babies had likely changed, yet nobody had truly measured that, or looked in the event that it was broad across the whole nation or in the event that it was simply in pockets. COLCORONA study shows that colchicine can decrease inconveniences in certain COVID-19 patients. Study recommends expected job for probiotics in forestalling respiratory contaminations. UAB Side Project gets $3 million in seed financing to foster probiotic details for lung well-being. Incubate and Associates inspected two enormous public datasets, affirming the progressions in rehearses. They saw information gathered over an 11-year time frame on the kind of respiratory help utilized for newborn children brought into the world between 22 weeks and 34 weeks incubation. In one of the investigation datasets that included admissions to more than 350 NICUs in the US, they tracked down that mechanical ventilation use in preterm newborn children diminished from 29.4% in 2008 to 18.5% in 2018. Broadly, the examination creators composed, the progressions were related with around 30,000 less babies getting mechanical ventilation during the investigation time frame. As the quantity of newborn children on mechanical ventilation went down, the term of time that ventilated infants spent on mechanical ventilators additionally went down. Likewise, in their discoveries, analysts found that the all-out number of days on non-obtrusive respiratory help went up across all gestational ages from 13.8 days to 15.4 days. Incubate said more exploration is expected to comprehend the ramifications of investing more energy in non-obtrusive respiratory help treatments. We need to sort out if the increment in term of respiratory help is something to be thankful for, and how does that deal with NICU length of stay and generally asset use for preterm newborn children in the US. It brings up more issues, he said. Also, they saw an increment in the quantity of very preterm babies, 22 to 24 weeks growth, being set on mechanical ventilation as there has been expanded mediation and further developed endurance for this age bunch. Bring forth takes note of that the respiratory health methodologies for this specific populace of newborn children needs more assessment. The field of neonatology has endeavored to inspect our practices and improve. I'm pleased with how rapidly a portion of the milestone respiratory consideration examines have infiltrated our clinical consideration, said Hatch. Care in the NICU is turning out to be less intrusive and gentler on the grounds that it is the proper thing to accomplish for children's drawn-out results.